Treatment of incisional hernia, open and laparoscopic approaches, open surgery, larger incision directly over the hernia, site for direct access, advantages, suitable for larger or complex hernias, provides direct visibility and control, longer recovery, often with an extended hospital stay, limited activity initially, gradual return to normal activities. Laparoscopic surgery involves making small incisions in the abdomen, inserting a camera and specialized instruments to perform surgery. Advantages: minimally invasive with smaller scars, quicker recovery and less postoperative pain. Recovery: shorter recovery, often outpatient, quicker return to normal activities. Considerations: choice between open and laparoscopic depends on hernia size, complexity, and patient's health. Consultation with a surgeon is crucial for determining the most suitable approach. For more details, connect with Dr. Tulips Todds at 988-613-9999.